You can get genetic testing to see what antidepressant to be on. Matter of fact, 3 million people as of this time last year have gotten GeneSight testing to figure out what antidepressant might be best for them. But is this overblown, or should you be forking over money to do this? Let's dig into it. So before we go any further, we need to understand what GeneSight testing is, or pharmacogenomic therapy evaluation. You get a cheek swab while in the clinic, and they're going to go figure out how you might react to these medications. On GeneSight's website, they advertise it as a pharmacogenomic test, which means that it analyzes how your genes may affect your medication outcome. They neatly organize all the medications into this stoplight pattern of green means go, yellow means think about it, and red means stop. And they have some glowing reviews from patients, if I might add, though the acting and music is a little bit corny.
Took my test in 2014, and I credit GeneSight for being here today, alive, healthy, and happy.
Met a new psychiatrist. She recommended GeneSight. 8 weeks later now, I feel normal. Probably the best I ever have in the past 20 years.
So this magical test determines what medications are right for you. Why isn't everyone doing this? Well, we actually have to look at the genes that GeneSight is targeting. GeneSight is looking at the CYP450 system. These are enzymes that metabolize drugs or toxins in your body. They're mostly found in your liver. And that's kind of where the first problem with GeneSight lies. It has everything to do with how you break down the drug and nothing to do with how the drug actually interacts with your brain. Like how we have every different type of gene affecting our metabolic tracts in our liver, we have all different types of genes and biotypes on our neurotransmitters affecting how drugs bind to them. If I only know how fast the sink drains, that doesn't tell me anything about how effective the soap is to scrub any of these dishes. Does that kind of make sense? GeneSight could label Wellbutrin as a red drug because you're a slow metabolizer of 2D6. It doesn't give you any insight as to whether or not Wellbutrin is actually a good medication for you. It just means you're a slow metabolizer of it. And if you're a slow metabolizer, you might do better at a lower dose of Wellbutrin. How could we possibly find out that you might do well at a low dose of Wellbutrin without doing genetic testing? I don't know, we could start at a low dose like we always do. With most of my patients, I start out at like a tolerability dose. Minimum effective dose of Lexapro is 10 milligrams. I usually started at 5 milligrams. Sometimes I have patients that stay on that 5 milligrams and they're like, it's perfect for me. When we go up to 10, I get side effects. So we just come right back down to 5. It's almost like we figured out that they're a slow metabolizer of Lexapro and they get side effects if we go too high, so the effective amount is at 5. And we managed to do all that without needing any genetic testing. Actually, if this medication, which might have been the best medicine for the patient that just happened to be at a low dose, could have ended up in this stoplight region where we never would have considered it in the first place. And conversely, the medicines that end up in like the green go area, mean that you're an average metabolizer of them, does not imply that it's going to be a good medicine for you. According to an AFP meta-analysis on GeneSight testing, they report that consumer marketing of this test may lead patients to believe that it can predict medication response, which may not always be the case. 13 antidepressants have enough pharmacogenomic evidence to warrant changes in therapy, where GeneSight evaluates about 57 medications. So in general, the convenience of this nice swab that tells you where your metabolism follows you is starting to turn out more like a crystal ball or an 8-ball situation rather than actual robust, scientific, deliberate processes that help us identify what the most effective treatments are going to be. Okay, let's talk cost. Medicare pays $1,500 for every GeneSight test, and the average patient is going to pay between $0 and $330 out of pocket. However, not all insurances are going to cover GeneSight. I have a lot of patients that are on mental health grants that get their treatment sponsored by the university. They're not going to cover GeneSight testing for that patient. So if they really want to pursue it, they're going to be paying upwards of $1,500 out of pocket. That's $1,500 out of pocket to figure out, does my sink drain fast or not, and giving us no information about whether or not these medicines are helpful to me. So personally, I don't really use GeneSight. The only time that I would really think about GeneSight testing is if I was stuck in a rabbit hole because patients were cranking up to really high doses of medications and they're not seeing any effect of them, or on very low doses of medications and they're still having side effects. However, if someone is failing multiple trials of antidepressants, in general, I wouldn't want to keep torturing them by doing extra testing to figure out what might be the right drug for them when they could benefit from something like TMS or ECT. Now, if for whatever reason they're not able to do TMS or ECT or esketamine, then maybe we have to go back to figure out what the GeneSight testing would look like. But this is almost like a final last-ditch scenario where I would truly consider using this. Most of the time, if someone's not effectively responding to these medications, we're going to run them down the pipeline and get them to safe, effective procedures that can bypass their entire metabolic system. So overall, GeneSight promises a lot. I think it delivers on some of those promises, but relatively few of them. I don't tend to recommend it for my patients. I think that there's not a lot of harm in it besides the cost, which is often passed on to the patient, or ultimately like pigeonholing what medications may be effective for people to kind of run around in circles and pass over possibly good medication candidates. I don't think that it's never useful. There may be some times where I do it, but it is much more the exception than the rule for me.